heard the benefits of testosterone therapy, but recently I met a man who has discovered just how much testosterone therapy has changed his quality of life. Check this out.
In 2010, Rick James, a husband and a father in his mid-40s, was diagnosed with early-on Parkinson's disease.
At the worst, I could wave. That was about a bit as good as I could wave. I would flop my foot. It started to flop. What really was bad was when I was under a lot of pressure from death in the family, and my whole back just locked up. It was just totally painful, and I was just laid on the ground for most of the day because it was just too painful to move. And that's dystonia, which is basically the coming onset of Parkinson's.
These are the medicines that he had to be on to be able to function.
After the side effects of all the drugs took over his body, Rick decided to follow his wife's suggestion and try testosterone therapy.
We're not going to say that testosterone cures Parkinsonism, but what it does, as it has for Rick, is is forestall the progression of the disease and actually helps these individuals become more functional with less medication.
Yes.
I think that's that's the big thing, is that they're able to function better on less drugs, and that to me is just a tremendous benefit for them. The testosterone therapy will prevent them from losing muscle as quickly, and they stay functional longer, so therefore they don't have to advance the amount of medicine that they take. And that's what Rick is finding, is that I can do without a lot of this and only have to take a select amount of certain medications so that I stay as at my functional best.
My biggest thing is I don't want to be a burden to my wife. And there is a lot of people out there that, and I know some of them, I mean, it breaks my heart, where they had basically got diagnosed with Parkinson's, and the wife was kind of like, I didn't sign on for this, bye. And it's kind of like, our kids are just getting to the point now where they're independent, and it's kind of like, now I don't want her to be be dependent upon her. So I'm trying to do whatever I can to keep that from happening. So if it means getting a few pellets in the hip once in a while, if that works, great. If it means getting on a treadmill once or twice a week, great.
When we have our maximum production of hormones and we are at our physical best, and we have less disease at that time, so wouldn't it make sense that if we can regenerate the hormonal levels that a woman and a man would have in their mid to late 30s at the very latest, that we would be able to start reconstructing the physiology you need to basically stay healthier, have a better quality of life, and maybe add a few years on to the end of the road.
I want to see where this leads. I want to see if I can get off the meds altogether. I want to see if I can get to a point where you can basically say exercise can cure Parkinson's, but you kind of need a little boost to get it. I don't know that if somebody's in their 70s or 80s will be able to kind of get the benefit, but if it's an early onset, then you should be able to ward it off really fast and easy if you can actually use the exercise. And they're finding out just right now how much exercise really does help with Parkinson's.
Today, Rick can exercise more and takes fewer medications.
Every time I come in here, I want to be better than the time that I was before.
And are you?
I believe so. Would you say so? Yeah, I believe so.
All right, well, there is a special offer for our Sonoran Living viewers. Dr. Tutera is hosting a free seminar. That's February 7th from 5:30 to 7 p.m. at the Melting Pot in Scottsdale. Everyone who shows up will receive a $30 discount card, but space is limited, so they would like you to call and reserve your spot. Or for more information basically on SottoPelle therapy, all you have to do is call them at 480-874-1515. They have a website, SottoPelleTherapy.com. You can also take a self-test on the website to see if you're suffering from hormone